You've probably heard about it. A medication that was first made for diabetes is now making headlines for helping people lose a significant amount of weight. It sounds incredible, right? Well, today we're going to pull back the curtain and look at the actual science behind semaglutide. That's the key ingredient in drugs like Ozempic and Wegovy. So let's get right into it. All right, here's our game plan. First, we'll talk about what this viral drug actually is. Then, we're going to explore the fascinating way it rewires your hunger. After that, we'll look at the real-world results, the actual numbers. Then we'll cover the side effects and what's up with Ozempic Face. And finally, we'll tackle the big one, is this medication right for you? First up, let's cut through all the noise. What exactly is this drug that's all over TikTok and the news? And why do you keep hearing different names for it? Let's clear that up. So, you've probably heard Ozempic and Wegovy thrown around, maybe even used to mean the same thing. And well, that's because they are. It's the exact same active ingredient, semaglutide. The main difference is the branding and the FDA approval. Ozempic is approved for type 2 diabetes, while Wegovy is specifically approved for weight management, and it's often prescribed at a higher dose. Same stuff, different jobs.
So what is semaglutide really? The simplest way to think about it is this. Your body already makes a hormone called GLP-1. It's one of the things that tells you, hey, you're full, stop eating. Semaglutide is basically a souped-up, long-lasting version of that natural hormone. And the craziest part? Its power for weight loss was kind of an accidental discovery. While they were testing it on people with diabetes, researchers noticed this incredible side effect. Patients were losing a ton of weight.
That accidental discovery really gets to the heart of it, right? How does one little molecule completely change our relationship with food? Well, the secret is in how it works on both your body and your brain. It's like a powerful 1-2 punch. Okay, so here's how that 1-2 punch works. First, it does its original job, which is helping control blood sugar. But then it does 3 amazing things for weight loss. Number 2, it literally slows down how fast food leaves your stomach. That means you feel physically full for way longer. Number 3, it works on the hunger centers in your brain to just dial down the cravings. And finally, number 4, it tells your brain you're full, but it's like it's shouting the message through a megaphone, so your brain gets it loud and clear. And what all that biology adds up to is something really, really human. People often describe it as quieting the food noise. You know, that constant chatter in your head about your next meal or that snack you're trying to resist? For a lot of people, it's not just about being less hungry. It's about feeling a sense of peace and control around food, sometimes for the first time ever. So the science is pretty incredible. But let's get down to brass tacks. What are the actual results? When we look at the clinical studies, how much weight are people really losing? The big number that you'll see from the major clinical trials is this one, 15%. On average, people taking the weight loss dose of semaglutide lost about 15% of their body weight over 68 weeks. Now, in the world of weight loss medicine, that is a massive, game-changing number. Just to put that 15% into perspective, let's make it real. If someone starts at 220 pounds, a 15% loss works out to 33 pounds. That brings them down to 187. That kind of drop is often more than enough to seriously improve health issues tied to weight, like blood pressure or prediabetes. But, and this is so important to hear, it's not a magic shot. The results can vary a lot from person to person, and the medication works best when it's used as a tool alongside lifestyle changes. We're talking better nutrition, more movement, and building healthier habits that stick. It's a powerful partner, not a replacement for that work. Okay, let's talk about the other side of the coin. Every powerful medication comes with potential downsides, and it's really important we talk about the side effects, the risks, and some of the myths you might have seen online. The most common side effects are not surprisingly gut-related. We're talking nausea, vomiting, diarrhea, constipation, that kind of stuff. And it makes perfect sense, right? The medicine is slowing down your whole digestive system. For most people, this is worst when they first start the drug or up their dose, and it usually gets better as their body adjusts. Now, besides those common issues, there are some rare but much more serious risks you need to know about. Things like pancreatitis, gallbladder issues, and a warning about a potential risk for certain thyroid tumors that was seen in studies with rodents. This is exactly why taking this medication without a doctor's supervision is a huge no-go. It is absolutely non-negotiable. So let's tackle that term that's been all over the internet, Ozempic Face. Is this a real unique side effect caused by the drug itself? The short answer is no, not really. Ozempic Face is just a catchy new name for a very old phenomenon.
Anytime a person loses a lot of weight quickly, especially from their face, the skin can lose some of its volume and look a bit saggy or gaunt. It's a result of the fat loss, not a direct effect of the medication.
And all of this leads us to the final, and probably the most important question of all. After hearing all this, how would anyone know if this is a path they should even consider?
Well, doctors have some pretty specific clinical guidelines. It might be an option for someone with a BMI over 30, which is the clinical definition of obesity, or for someone with a BMI of 27 or more who also has a weight-related health issue. But it is definitely not for people with certain personal or family histories of thyroid cancer, a history of pancreatitis, or for women who are pregnant. And of course, these are just general guidelines. A real decision can only be made with your doctor.
Now here's the catch. This is a critical piece of the puzzle that has to be discussed. The studies are very clear. When you stop taking the drug, the hunger-suppressing effects go away. That food noise comes back, and most people regain a lot of the weight they lost.
And because of that, there's a huge shift in thinking. This isn't a quick 3-month fix. For many, it's being viewed as a long-term treatment for a chronic disease, the disease of obesity. You have to think of it less like an antibiotic you take for a week and more like blood pressure medicine you take for years and years to manage an ongoing condition.
Which leaves us with this final, massive question at the center of this entire revolution. When it comes to managing weight, which is such a complex challenge, what's the right path forward? Is the answer in